Hi, horse friends. In today's video, we are going to address the topic, why is my older horse not shedding out this spring?
As well as it normally does, or as well as, your younger horses. And there are a few different reasons that can go into why your horse might not be shedding out. And while we're going to specifically talk about older horses in this video, this can apply to younger horses, but right now we're talking more about older horses because there's a handful of things that can affect them a little bit more so.
Yeah. And so when we say older horses, it's generally horses age 15 and up as well that fit into that category. That is what they call senior. So there are several things. First, I'm going to go straight to the one that is most common with not shedding out, and that is Cushing's disease or PPID, which, if you guys don't know, is a tumor on the pituitary gland, which affects cortisol in the horse's system. We have a very detailed video on Cushing's disease in our channel underneath the health playlist too, that I suggest that you take a look at.
And we'll just go a little bit more into detail what it is. And
yes. Yeah.
Gives you more information on it and some of the options you can use to treat it and how you figure out if your horse has it or not.
Yeah. And so one of the telltale symptoms of Cushing's disease is that they don't shed out as early or as well or at all as younger horses.
One of the other signs is just more hair growth.
Right.
When they get their winter coat and everything else, it's usually longer. It can be thicker. And sometimes it can be a little bit scragglier too.
Right. Right. And so there are several treatment options for Cushing's disease. The brand is Prascend. And, how your vet will test for that is they'll do an ACTH blood work test, which we also have a video on as well, and determine if they're in that gray area. Now, generally, you start to see this in the spring because what happens is all winter long, you go out and you think, oh my gosh, look at my horse. It's just got this wonderful winter coat. And then in the springtime, you expect them to start shedding and they're not. And so when you see that, I really do suggest that you call your vet right away, because if you don't catch it ahead of time, you can end up with laminitis. So the treatment options, once again, are Prascend, and there's also a new version that came out that is a generic version of Prascend. It's a little bit cheaper. It's called Prgolide. We haven't posted the video on that, but we will. So if you're watching this later, it will already be posted. And Prgolide is like I said, a cheaper option. But there are also some other reasons besides PPID that would cause your horse to shed out later.
Weight and overall body condition, typically, not always, but typically if they're underweight, they're going to hang on to that hair more. They need that warmth and it just takes a lot of more energy for them to shed out and or to build up a winter coat. So if they're not at enough weight or they're lacking a certain nutrition, it'll be harder for them to shed out properly. And then also worm load.
Yes.
If they have a lot of worms, it can
really affect their coat.
Yeah, it just takes more energy when the energy that they're getting in from their feed, whatever it happens to be, and it's going to different places and you have that parasitic load. They're expending that energy and it's getting stolen rather by the parasites, or if they're underweight or missing some sort of nutrients and everything else, things are going to be diverted into different ways, and it's not going to go to the coat because that's kind of like low on the list in a sense.
So one of the things that, Becca just brushed on is overall general health. And it takes vitamins, minerals, nutrients to grow a coat and to shed a coat. As a horse gets older, they do not absorb their nutrition as well, which is why you have senior feeds and different things along those lines that help balance that nutrition. And so if let's say your horse isn't dropping their coat, you go and do the Cushing's test, the ACTH test, or a metabolic panel as well, because there are also other metabolic conditions that can cause horses to not lose their coat, and everything comes back normal. I suggest then you start taking a look at their nutrition panel, making sure that they are getting what they need for their coat to drop and shed correctly.
Yeah. And checking out different things, their teeth, their gut, to make sure that they're able to actually get the nutrition that they're getting. So my own old guy, not really shitting out too well. He's getting better a little bit, but also underweight, and it was trying to pack weight on him, doing different things. And this has been going on for a while. I had vets out multiple times. I did the Cushing's test and other metabolic disorders. Everything came back normal. One of my vets said that his gut sounded like an ocean, and you don't want that. No. And that means he's loaded with sand. And what she was telling me was that they cannot absorb the nutrition of whatever they're eating. So no matter how much you throw at them, they can't absorb any of that, any of the calories, any of the nutrition, everything, because the sand is just in the way. And so you get the psyllium, and so we're on a pretty rigid structure right now. So I'm hoping that'll help, because this has happened before with him. He's fun like that. And he's old. So I'm hoping this will help him, and everything else, keep an eye on it. It's going to be a few months before we really see anything. But right now, that is the treatment, is treating him for sand and everything else. And because it is loaded in there and he's not getting any nutrition. And then he's on cubes, he's on senior and different stuff. He gets hay, but he can't really eat it anymore because he doesn't have the teeth for it.
Yeah.
And mind you, the cubes are soaked.
Yeah. And I think the bottom line is, when you have an older horse, it's important that you try to get ahead of these conditions, right? If you see them starting to lose weight, if you see them not shedding out their coat correctly, early intervention with these, diseases or processes or things that are going wrong really does help them, because their bodies, because they are older, don't respond as quickly. They don't bounce back as quickly. It takes a long time. I found that with Prascend or treating Cushing's horses, it can take, honestly, a year or two, sometimes depending on the horse, for their coat to bounce back the way it should. Now, if your horse still isn't shedding out despite all of these things, and it's coming into summer and they're getting hot, please consider body clipping them, because you don't want your horse to overheat, and you don't want them to develop colic and other problems because they are getting too hot. So talk to your veterinarian about all of these different medical conditions that could cause this, because you need to go through your veterinarian for all this stuff, because these are problems that need veterinarian diagnostics. Yeah. Our job is to just kind of help you get on a path and help you understand what it could be happening. Right?
And what some of your options are in that. And again, talking with your vet too, they can look at the horse's history and see, is this a pattern? Is this something that's been going on? Is this new, what have you? So they can look at the history. They can look at, have you done the blood test before, and what was the results then, right? If you have a horse that you did the blood test on before and then they were borderline, well, now they might be actually PPID now.
Yeah, and we have a horse recently, for example, that she was borderline in her blood work, but she had all the symptoms. So the vet and I are looking at the blood work. Well, if she's not actually Cushingnoid, she will be. So we're going to go ahead and treat her, because we don't want laminitis. We don't want founder. We don't want these other issues that are much, much worse. And then we're on our heels in trying to treat this stuff. So, yeah. So let us know your thoughts. And I appreciate you guys joining us. And these are just some of our suggestions.
Yeah. Thank you.